People with severe mental illnesses have up to a 20-year shorter life expectancy than their general population. Well, this means that some people living with bipolar disorder or schizophrenia have the same life expectancy of someone living in the 1950s. This is all from a report by the Royal College of Psychiatrists and Public Health England, which is calling for more to be done to address this situation. Well, we can talk now to Andrew Gordon, who's a Labour councillor for Basildon and lives with schizophrenia. Andrew, thank you very much for coming in to talk to us about this. It's quite shocking, isn't it? Somebody with a mental health issue is expected to live 20 years less than those who don't live with it. What do you think some of the factors at play are?
I think one of the big ones is, of course, when you're put on medication. Medication can make you put on quite a lot of weight, and of course obesity can have a lot of effects. The other one is, of course, smoking. You know, when you're really struggling in life, a cigarette is that too much to ask for? I don't know. But I think the other one is, of course, suicide. You know, the biggest killer for me as a guy under the age of 45 is I'm likely to kill myself. So I think those three factors combined probably make it really difficult for someone. I mean, I've got 20 years cut off my life. I'm not sure how I feel about that.
But... No, not too happy, I would imagine. So this report is highlighting this issue and trying to get something done to address it. Talk to me about living with schizophrenia, because you're quite keen to share your experience. Absolutely. And often when we talk about mental health issues on Sunrise, it's always about men who don't want to talk about it, whereas the perception is women talk about it more freely and therefore get more help.
I think it's important to talk about it, firstly, and any opportunity I have to talk about it, I will. I think what it's like living with a mental health condition, I think, if you had any health condition, it's like a spectrum. You know, you're well, you're unwell, you flux in and out.
Good days, bad days.
Good days, badly, yeah. I would argue I have a healthier mental health than most people in the country because I know how to manage my health. If you had a heart condition and your doctor said to you, okay, you know, you've got to get healthy, and if you don't get healthy, you don't start physically exercising, you're going to die, chances are you're going to start becoming physically healthy. For me, I need to be mentally healthy, because if I'm not, the consequences are quite severe. So that includes self-harm, that includes suicidal ideations. So sometimes I will obsess about killing myself. Sometimes I'll wake up and pretty much every half an hour I will think about killing myself. At the extreme end, I can start having auditory hallucinations, so hearing voices, and that's quite a scary experience. Delusions, paranoia,
which is some of the symptoms of schizophrenia that people know the most about.
I would imagine also stress, although that seems like a silly thing to say.
No,
if you have that condition, you are in a state of stress all the time, which is a massive contributor to death.
Yeah, I mean, imagine someone talking in your ear constantly. That's what it's like, you know, it's like having...
We have that every morning.
It's like a running commentary, it was at the time. I mean, I don't experience those symptoms now because I'm keeping myself well, but I know if I'm not keeping myself well, that's what it could end up as. That's the path I could end up going down. And the thing that frustrates me the most is that I can't get help early on. So I know my signs and symptoms. I know when I'm becoming unwell. I know when I actually have to say to myself, Andrew, you need to take a step back. But if I go to my doctor, he's got no place to refer me. I'm not unwell enough to actually get the help that I need.
You're treating yourself, essentially.
Oh yeah, I mean, I have some really dark days sometimes, but I've either got a choice, and I'm going to paraphrase the Shawshank Redemption. I can either get busy living or get busy dying. Because if I made the decision to give in and be sort of surrounded by these really depressing, dark thoughts, then to be honest, I may as well jump off a building. But I think I make the decision to fight every single day. And it's interesting, that the report says, people like me are going to die 20 years younger. Well, actually, I could have died when I was a lot younger. And every single day I'm living now is a gift to me. It's a day that I wouldn't have had.
Well, Andrew, it's really interesting to hear you speak, and I know that you are talking to a lot of people, not just on television, but conveying your message personally and putting the message. It's okay to talk about mental health and ask for help. So thank you very much for sharing your story with us here on Sunrise this morning. Andrew Gordon there, Basildon Labour councillor.